listening to Planet Vero Radio. I am Cindy Schwartz. And today, in this short 10-minute interview, we're going to be talking about ways patients can be better informed about their health care. And hopefully, it'll give them some information on what they need to know and help the doctors out, too, as well. So on the phone, I am talking with Dr. Paul Wang, and he's a practicing anesthesiologist, and he actually practices up in Toronto, Canada. But anesthesia and anesthesia wherever it is the same thing, isn't it, Dr. Paul? How are you? Good to talk with you.
Good. Thanks for having me. Yeah, you're right, Cindy. Anesthesia, is pretty well the same in Canada and the United States. The basic practice is the same, and what you can know about anesthesia up here in Canada is similar to what happens in the States.
Okay. So what we want to do, Dr. Paul, today, you and I chatted a little bit before the show, is just give a couple of maybe 4 or 5 tips. You got the inside scoop. And you anesthesiologists are the doctors that I don't want to say we're afraid of, but you're like the unknown. You are the unknown people because you don't have office hours. So it's not like you can go and see the doctor like you go and see a surgeon or a GP or however you want to call it.
Yep.
So you're the guys that we see kind of as we're getting the mask put on us and we're scared to death for surgery anyway.
Yeah.
So I want to have everyone feel comfortable. You told me a ton of information and, let's have at it. So the first thing, let's talk about maybe catheters. So people are afraid about catheters. It's very personal. I mean, it's an invasive procedure. So why do people need catheters for surgery, or maybe why don't they need them?
Well, I would say that, having not everybody needs a catheter for surgery.
Okay.
And it's only in certain particular surgeries that catheters are necessary. That is, if, for example, you need a urinary catheter, if it's going to be a long procedure, and, the bladder has to empty during the surgery, and you want to figure out how much urine output is occurring in a patient, then, for these bigger surgeries, long surgeries, catheters are important. Mm-hmm. But for most, I would say 90%, maybe over 90% of cases, you don't need a catheter. Catheters, because, the surgery doesn't last that long. And by the way, just so that everybody knows, while you're asleep, you're not going to pee. Okay, unless your bladder is explosively full of urine, you're not going to pee. So, for most cases, I would say you don't need catheters. And in addition, I would say that to get an unnecessary catheter is bad because catheters can cause strictures, they can introduce infection, so it's not necessary for the most cases, and that's good to know.
It is good to know. And so the patient should have that conversation certainly with their surgeon because, the surgeon is in charge of all of that, I'm thinking. Okay, so that's but keep it in mind, listeners, that, Dr. Paul's saying have the conversation with the doctor.
Absolutely.
Don't just assume that you actually absolutely need this, that it's imperative. Certain situations, certain surgeries, yes, it is. Absolutely. We're not going to say that. But
so have the discussion with the surgeon before and be informed about whether you will need a catheter or not. Because, if I had a surgery and I suddenly woke up with a catheter, I'd go, what the heck's going on?
Right.
Because, it's not a nice surprise.
Yeah, absolutely not. And even when you're out under anesthesia, sometimes that's kind of the catch-all phrase, oh, well, we do it while you're out. Well, that's a rude awakening when you wake up and realize that people were touching you and doing this and, blah, 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 and maybe you don't need it. Okay,
exactly.
So great to know. So the next thing we were talking about, Dr. Paul, is blood transfusions. So you had some great insight about that. So blood transfusions are something that you as the anesthesiologist are in charge of, not the surgeon.
Yeah, that's a lot of people don't know that, but it's the anesthetist or anesthesiologist who decides and gives the blood in discussion with the surgeon. So the thing that I want everybody to know is that, if you do need blood, and it's important to get blood, let's say you're in a life-threatening situation, in a trauma, or you have a big operation, you suddenly lose a whole bunch of blood, blood is necessary. What the blood does, it helps transport oxygen through all the tissues. So it is important. However, we in the modern day of surgery and anesthesia do not give blood unnecessarily. You can have your hemoglobin almost fall if you're a healthy person and it's not an operation where you're suddenly losing blood. Lose almost 30%, 35% of your blood volume before there's a trigger to give blood. And the reason is that there's some very interesting facts that have been discovered about blood transfusion. Each unit of blood you get, let's say you're going for a hip operation, knee operation, increases your risk of infection. So that's a very interesting fact.
Huge.
Secondly, each unit of blood that you get if you have a cancer operation increases your risk of cancer recurrence. And the reason this is happening is that each unit of blood alters permanently your immune response. And this was discovered years ago when people had kidney transplants. Those who, this is before the era of modern anti-rejection drugs, those who got blood didn't reject the kidney as much because their immune system was masked to the foreign substances of the foreign kidney, and the kidney would be accepted more. So, again, if blood is necessary under a trauma, whether and you're rapidly losing blood and you're going to lose more than 40% of your blood volume, you need it to transport oxygen throughout the body. However, in the modern day, if it's a controlled loss and we feel as though you don't need the blood, we'll allow your hemoglobin to go, let's say, starting at 130, which is grams per deciliter, which is a measure of the mass of blood cells, all the way down to 68 or 70. So that's a big decrease that we're going to allow to say, look, no one's going to panic. This person who's healthy, within a few weeks will recover that hemoglobin. Hemoglobin is produced very rapidly in the bone marrow. So we don't have to worry about that. So that's an important fact to know. And I think most modern anesthetists and surgeons know that fact. It's a well-known fact.
Okay, so the patient, again, should have the conversation with their doctor, bring it to the table, say, listen, I've heard about this. I know that it's true. I mean, Dr. Paul Wang, you're a doctor. You know that it's true. So just keep it in mind. I mean, we're not giving medical advice here, but we're just saying, you have to be educated as the patient. Another thing that you and I talked about, Dr. Wang, is about the patient keeping as warm as they possibly can to do anything that they can. Put the warm blanket over their head. I mean, anything like that. When you're handed the blanket from the nurse to get ready for your surgery, don't discard it. That's an important piece.
Yeah, absolutely. I mean, when you come into the hospital, they'll give you blankets and so forth. Cuddle up, warm up with those blankets. The reason is, the operating room is very cold. It's cold, designed to be cold, so the surgeons be comfortable, and we have devices to try to keep the patient warm. But, when you're under anesthesia, you dilate all your blood vessels, and you lose heat very, very rapidly. And what's the problem with losing heat? Well, in the old days, they never thought it was a problem, but they found that there are major problems if you lose heat. You stress your heart if you have heart disease. Number two, you increase your chance of bleeding. If you are bleeding from any wound during the surgery, if you're cold, you're going to bleed more.
Yeah.
And from an infection standpoint, the colder you are, the greater chance you are under a long anesthetic, long surgery, to have a higher rate of getting infections postoperatively. So, it's because your body is designed as humans to maintain a constant temperature, and anything below that, the enzyme systems, the immune system enzymes and so forth, they're compromised. Excuse me. And so because of that, all these, the coagulation system, the immune system, your ability to fight stress, it's all going to be compromised. So
we have like a minute left, Dr. Paul. I want to get to this subject, too, because I think it's very important, and it's scary for people. Keep your underwear on, you told me.
I got these things where people are coming for, bunion surgery, and they're told, or they think they have to take their underwear off.
Yeah.
No way. It's not, there's no way that you have to take your underwear off there. I mean, it has nothing to do, obviously they're operating down at your foot. They're not operating down, up at your underwear.
Right.
So, I mean, if you're having hernia
exactly.
surgery or something, but you don't have to. You can preserve your dignity and your pride and keep your underwear on.
Okay, that's the best statement. You know what, Dr. Paul? We have like 15 seconds left, so I want to say a huge thank you to you. You gave us really 4 pieces of great information. And also, if people are interested, your book is How I Got a Hold of You, Operating Room Confidential by Dr. Paul Wang. Read it. Some great information. Thank you so much, and you are listening to Planet Vero Radio.
Okay, thank you, Cindy.